If you or a loved one have ever been diagnosed with CRPS or complex regional pain syndrome, then you know how life-changing this diagnosis can be. CRPS is one of the most painful conditions a patient can be diagnosed with. Today I'm going to get into one of the treatment options for patients with CRPS, which is a lumbar sympathetic block. So this diagram here shows you the lumbar sympathetic chain, which is a bundle of nerves that sit on the front and side of the lumbar vertebral vertebra. This chain of nerves is pretty specialized, so it maintains sympathetically mediated pain, which is that fight or flight response. When patients develop CRPS, it's usually because they've had an injury to their extremity. Even when the problem has been treated, the nervous system may continue to stay in that fight or flight response and send pain signals that aren't appropriate anymore. When we do a lumbar sympathetic block, we put numbing medicine around this chain of nerves to essentially stop the nerve transmission and hopefully reset the system and stop this fight or flight response. When I do a lumbar sympathetic block, I do it under x-ray guidance for safety. So I guide the needle, like you can see here, to the L3 or the third lumbar vertebral body. That's typically where we block this chain of nerves because it's right in the center of the lumbar spine. And then I use x-ray to guide the needle to the front of the vertebral body. Usually these injections are done in a series every 2 weeks combined with physical therapy. We want to try to treat CRPS as aggressively as possible. The goal of the blocks and the physical therapy is to desensitize the nerves in that area and get the patient function back. CRPS is the most common reason why we do this injection, but you can also use it for peripheral arterial disease or Raynaud's to help dilate the vessels in your lower extremities, or you can use it for neuropathic pain problems like postherpetic neuralgia, painful diabetic neuropathy, or phantom limb pain. If you have questions, leave them in the comments, or if you're a patient that suffers with CRPS, let me know what's helped you the most.